You want the, is it better with the blurry thing on or the not?
Whatever you like. That looks just fine.
Okay,
Yeah,
sounds good.
you're in good shape. You're a pro at this by now. Dr. Mills, can you tell me a little bit about the announcement today says that people are going to be required, who part of the care team. What does the care team encompass?
Yeah, so it's all of our employees.
Okay.
So we are implementing as of October 1st, basically as a condition of employment that every one of our employees, or what we call our care team members, must be fully vaccinated against COVID-19.
Why October 1st?
We wanted to give people plenty of notice if they were able to get vaccinated, if they haven't already. And also, for the rare person who does need an exemption, a medical or religious exemption, then we have time to process those.
Gotcha. And is there any, I know that other hospital systems are looking at whether a vaccine gets full approval by the FDA. Was that a consideration that entered into this decision?
The FDA full approval really was not a consideration of ours. The vast majority of health systems around the country that we looked into that are mandating vaccines for their employees actually have picked a date, usually 6 to 8 weeks later from the announcement, and they're not tying it to FDA approval. And the reason why we think that makes sense is that the safety and efficacy thresholds for the emergency use authorization for FDA are essentially the same as for full approval. The main difference is the amount of time for monitoring clinical trial participants, a median of 2 months for emergency use authorization and a median of 6 months for full approval. However, in the last 200 years of vaccines, there's been no significant side effects found after 6 weeks after the final dose of a vaccine. So we're very confident in the safety and efficacy of the vaccines that we have we are very confident in the safety and efficacy of the vaccines that are authorized by the FDA at this point in time. And they're, the safety and efficacy thresholds are the same as for full approval. So to us, it didn't make any difference. We expect that at least one of them will be fully approved by the time October 1st rolls around, but we also didn't think it made sense to tie our mandate to that date.
Gotcha. And what will happen to employees who refuse to take a vaccine?
So there are people who can, so there are medical and religious exemptions that we will consider. And so people can apply for that. And we expect, as with some other health systems around the country, that if people don't comply and they don't have a bona fide religious or medical exemption, then they may need to be terminated. But that has happened across the country, but in very small numbers. We also mandated flu vaccine a year ago, and the state law goes into effect October. Sorry, just a second. Also, we know that we've already mandated flu vaccine as of a year ago, and the state also is mandating that as well. Also, MMR, measles, mumps, rubella, and chickenpox and hepatitis B vaccines are already required as a condition for employment for all healthcare facilities. That's been the case for years. And so we don't expect that really too many will not comply with this. People who go into healthcare generally believe in science, believe in vaccines, and there are a number of other vaccines that people do need to get if they're going to work in a healthcare environment.
The information we got from MaineHealth says 83.8% are already fully vaccinated. That leaves about 16.2 or so that are unvaccinated. Do you know what the major concerns are from the people who are unvaccinated, why they have yet to get a vaccine? Have you heard anything from
yeah,
staff?
I think it's the same as across the country and other hospitals and health systems, that people are, concerned because it's a new vaccine. We feel confident now that it's been a year and 200 million people in the US have gotten vaccinated, and we've had the most intense safety monitoring system in vaccine history over the last year. So we feel very confident about that. And we are planning ongoing educational sessions and outreach with our employees who aren't vaccinated yet. But we have very few, really. We have one of the highest vaccine rates in the state. We're very proud of that. And at Maine Medical Center, it's about 88% who are fully vaccinated. So we're very confident that the few who are left, that we can help them along with this. And I should just mention that the vast majority, there are about 85 health systems and hospitals around the country that have mandated COVID vaccine as a condition of employment. And the majority of them actually are not tied to the FDA approval, that they're using the FDA authorization as their threshold.
Got it. And just to clarify, the October 1st deadline, is that to begin the vaccination process or to be fully vaccinated?
To be fully vaccinated. Yeah.
Okay, understood. Okay.
Oh
No, go ahead.
I was going to say, these vaccines are not only very safe, but they're also very effective, and they're effective at protecting our people who are getting vaccinated. They're also very effective at protecting others, and for when you're working in healthcare and you're working with patients, it's so important that our patients feel safe when they're around our healthcare team members, that they feel safe, that they're not going to contract COVID from somebody who's trying to treat them. So we think that this is in line with our mission of excellence and being patient-centric and really working together so our communities are the healthiest in America. That is what our mission at MaineHealth is about. And so this vaccine is very much aligned with that mission. We want to have patients and their families to feel safe when they're in our care.
There's been some, kind of just, I think people just curious about this, right? The way that things had been set up earlier, before we had so many changes in the vaccine rollout, was healthcare workers would be some of the first responders, emergency medical providers, healthcare workers maybe who work in nursing homes and so on and so forth, and teachers were all generally towards the top of the list. Do you anticipate that there will be any type of statewide requirement for teachers and then possibly even students, who I understand right now it's only 12 through 18 in public school would be eligible, but do you anticipate that teachers and students will be required by the state at some point to have a COVID-19 vaccine?
I mean, maybe eventually. I can't speak. I have no inside information about this fall and winter, but certainly maybe eventually. We don't know. But what I do know is that many hospitals and other healthcare providers, nursing homes, and private industries that aren't even in healthcare are starting to require the COVID vaccine as a requirement for work. And so even companies like Disney and Walmart and Google and Facebook, all these household names, companies are starting to require some kind of vaccination for COVID as a condition of employment. So I think we're going to start seeing not only the private sector, and possibly the government sector as well, starting to require it. It just makes sense when you're working with each other, with the public. You want to make sure that people around you are safe and that your employees are safe as well. Vaccines protect those who are getting vaccinated as well as others around them. And I should just mention, because there has been something made about the fact that some of the nascent data, the emerging data from the Delta variant, and how some of the nascent data from the Delta variant I know is causing some concern, because there have been people who are fully vaccinated who've contracted COVID and have had high enough viral loads to transmit it to others. However, what US CDC has been also saying is that the very vast majority of transmission right now, even with the Delta variant, is amongst the unvaccinated. So even though there are some occasional, maybe rare cases of people who are fully vaccinated who can contract COVID and sufficiently enough to transmit it to others, that seems to be right now a rare case. And what we know is that vaccine is the ticket to putting this pandemic behind us.
And MaineHealth, I assume, I figured I'd just ask as a point of clarification, is still going to be requiring care team members to be wearing masks, the distancing when appropriate, and then the hand hygiene as well until the CDC declares the pandemic is over?
Yeah, I mean, certainly the masking. So we are also reiterating that masking, hand hygiene, and distancing when possible, that those are all the strategies that we all need to pay attention to, particularly in healthcare settings. Those are mandated in healthcare settings by the federal government, but also even in our offices. We have gone back to doing some more distancing and masking right now, because we do see an uptick in pandemic activity in Maine. We know that although we're still in the moderate, most of our counties are in the moderate category of transmission, we see from our internal data and public health data that the trends in all of our counties are upward. So we are not only asking for people to be vaccinated, but also to go back even in our non-clinical office settings of masking and distancing and being vigilant around hand hygiene.
Understood. Is there any message for the employees who are refusing to be vaccinated, other than that they would have to be terminated? Is there any education that's going on around those who have been hesitant in terms of getting them on board?
Absolutely. I mean, we will be reaching out to those who are unvaccinated one-on-one and talking with them, having a conversation very often. In fact, probably most of the time when we're able to have a conversation and hear what their concerns are and address those, people are fine. That's been my experience anyway. They just sometimes just need a conversation, but we think this is the right thing to do at the right time. We want to make sure that people coming to any MaineHealth hospital or facility feel safe, that they are going to be taken care of by people who are fully vaccinated.
And lastly, what's the most common piece of maybe misinformation or disinformation that MaineHealth is hearing from employees who have yet to be vaccinated? Is there something that's floating around that people are saying, you know, this is why I'm not getting it?
I think from the public, I can't, you know, I hear a lot of myths out there through not only from our employees sometimes, but many others. I think the most common misperception I hear is that they're waiting for somehow the threshold of full approval from the FDA, when people don't realize that, you know, the safety and efficacy thresholds for full approval are the same as the current authorization. It's just a matter of how much time that the people in the clinical trials have been followed. But we know that they've been followed for months now. The clinical trial started a year ago. 200 million people in the US have been vaccinated with the COVID-19 vaccines, and in the most intense safety monitoring system ever. So we are very confident about the safety and the efficacy. And I just, you know, also just want to mention that, you know, one of the reasons why it's so important for us to vaccinate ourselves, not only protect ourselves, but to protect those who are not vaccinated yet. You know, 15% of our population are people 12 or under 12 years of age who are not eligible yet for vaccine. And also we have a number of people who are immune compromised or elderly or people who are medically frail, whose immune systems are unable to mount a sufficient response to the vaccine. So I think it's really important that we realize we're vaccinating not only to protect our own health, but to protect others who may not be able to get vaccinated or whose immune systems are not strong enough to mount a good response.